Our aim was basically to capture those key issues, the challenges, the key learning as well, about what really matters to people, about what they would and would not change and what would really make a difference in these circumstances.
It's about recognising care home expertise, sharing that amongst peers and making sure that the best support that we've had has come from each other. My staff are so determined and dedicated and are smiling and are doing the right thing, working really hard in a situation that means they're wearing a mask all day long. It's really tough, really difficult, yet, you know, we're maintaining a safe kind of, you know, everyday life for the people that we're looking after.
You hear things like, oh, they are not skilled workers, or they are low-paid workers. And when these boys and girls, they do everything and they have to be everything, especially during this pandemic.
Me, my lived experience of being a family member with my mother at home, I found it was very helpful to see how the professionals were dealing with the issues in lockdown and understanding their feelings about the matters which affected them and how they kept in touch with the residents and the family members, trying to facilitate contact under very difficult conditions, and really appreciate what they've achieved, and they had very little support.
I think those individuals who were engaged within care homes felt that someone was listening, and that was really heartening to hear. So it made us feel we're on the right track here. And I think, you know, particularly I thought it was really amazing to hear from the pair of care workers who talked about their, you know, their experiences and how being involved in this for them was very important.
We do everything for our residents, from washing, dressing, activities, you know, giving them love, kindness, you know, keeping their dignity, everything.
This is their home, you know, it's not like a stay in the hospital, this is the resident's home.
It's very important to keep the spirits up for everyone, keep everyone happy.
Leaving your worries at the door, isn't it? And then coming in, giving the residents this kind of environment that they need, you know, a happy environment, even with everything going on the outside. It's not just a job, you know, we want to do it for these residents. It's the only reason why a lot of people aren't giving up, because we care so much about our residents.
So there was lots of overlap and similarities across the conversations. So what we really wanted to do is bring them all together and highlight those key issues in a really accessible way. So looking at the data all together, we then identified 6 high-level themes that capture what was talked about in those conversations. So those high-level themes include feeling safe, feeling heard, feeling connected, feeling equipped, feeling valued, and feeling able.
We haven't planned any further conversations in exactly this way at the moment, but what we have done is link in with people who are already working with people in care homes so that we can contribute to that work. And I think that's a really helpful way to do that. And we've made the kind of anonymised information data from the conversations available to others, so that, you know, as Richard said, there's lots of interest in this area kind of across the country. And so by making that anonymised information available, that can help contribute to other projects as well.
For me, you know, one of the biggest messages is the level of innovation and creativity inside each home, and alongside that, the big differences between care homes. This is the opposite of cardiac surgery, where you're kind of trying to do one thing to one heart, and you need a machine that works in predictable ways. For working in care homes, you've got very different patient groups. You've got a building that is never the same in any one place, and a set of workers who have very different skills and strengths. And so the responses have to be very different in each care home. So how things happen in each care home has to be different. And I really want people who are putting programs in place to understand that.
Being involved in these conversations hopefully goes some way to reassuring people who live and who have loved ones in care homes, and reassuring that actually people can be safe, but also inspiring people to look to residential care as a place to work.